Health, Wellness, and Health Disparities, Part 2, Chapter 3 continued. Disparities in Healthcare begins on page 59, continues to page 61, the beginning of page 61. So these are some key terms that you must know. So health equity is attaining the highest level of health for all people. I briefly mentioned last week how the U.S., in comparison to other countries of similar social economic status, have a much higher incidence of premature deaths as well as illnesses and disease, and a lower number for the expected life outcome, or I'm sorry, life expectancy. So health disparities. Health disparities are usually linked with marginalized groups. Okay, so it's the difference um, in the health care that's provided to these marginalized individuals, right? So it includes social, economic, and environmental disadvantages, and is often influenced by race, ethnicity, poverty, sex, age, mental health, level of education, sexual orientation, the access to health insurance, and their access to health care. So I gave a brief example about sexual orientation last week and how these individuals who are transitioning are experiencing discrimination by healthcare providers. Social determinants of health. So social determinants of health are um, conditions in the environment in which people are born, work, live, play, worship, and age. And these social determinants of health range from health, functioning, quality of life outcomes, and risks. So here in our country, in America, your zip code will actually determine your expected lifespan. So in certain zip codes, you may not live as long if you than if you live in a different zip code. And I do have a video. Hopefully I have a chance to show that to you. So institutional and structural racism is the systematic distribution of resources, power, and opportunity in our society to the majority or those who are of Caucasian descent. And it also includes the exclusion of people of color. And so this institutional and structural racism is very closely related to unconscious or implicit bias. Okay, so implicit bias is prejudice in favor of or against one thing, person, or group as compared to another. So these thoughts are not um, overt, where they're intentionally being racist. However, it's an unconscious thing where they may see one particular race of people and they may think, oh, they're smarter, they're lazier, or they're faster as in physical speed, or they're kinder or better caregivers, or so they have their own conclusions in their mind before they even interact with this group or this individual or this um, particular demographic of people. So diversity. Diversity is welcoming individuals of different race, religions, nationalities, cultures, age, sex, and orientation, as well as identification, sexual identification. So you want to be able to display diversity as a nurse, right? You want to be able to care for whomever and anyone that's in need of care without bias. And we all do have our own implicit bias. Again, as I said, this is unconscious, where explicit bias is a conscious effort, and that is overt racism or prejudice. Inclusion. Inclusion means giving everyone a sense of purpose and belonging. So that is welcoming everyone, opposed to this institutional and structural racism where it's actually excluding some and welcoming others. So inclusion welcomes everyone regardless of their belief, regardless of their race, religion, nationality, culture, age, sexual orientation, or identity. Equity is ensuring that everyone has access to the same conditions and they can thrive. So we just talked about health equity, and that was having access to health care for all people, right? Or being able to provide the same level of health access for all individuals, right? And a vulnerable population. So the vulnerable population is considered a health disparity, and this is something that is preventable. However, this vulnerable population often stems from racial, ethnic minorities, poverty, women, children, older adults, residents in rural areas, believe it or not, because they don't have access to things that an urban setting would, such as some of the better hospitals, or just even access to health care because they may have to drive 50 miles just to see a doctor, right? Low income areas such as the inner city are at a disadvantage. People with disabilities or special needs are at a disadvantage. So these are all considered vulnerable populations. There's other ones such as like prisoners, as well as people that are have different sexual orientations. So factors affecting health and illness. We have four categories: basic human needs, human dimensions, self concept, and risk factors for illness and injury. So, human dimension actually has six subcategories or interdependent parts, and they include the intellectual, environmental, spiritual, cultural, emotional, and physical state of the whole person. So this is found on page 56. There's a picture. However, on page 64 through 66, it talks about all of the subcategories. So human dimension, we'll just begin with that. The factors influencing a human dimensions are the factors influencing a person's health, illness status, beliefs, and health practices related to the person's human dimension. And we'll talk about each dimension on the next slide. So, basic human needs. So, basic human needs is something essential that must be met for emotional and physiological health and survival. Self concept, which is on page 66. Self concept is another variable that influences health and illness of a person. Self concept um, on how they feel about themselves or their self esteem and how they perceive their physical body image. So, self concept has both physical and emotional aspects to it. And these factors can impact a person's health and illness. Then we have risk factors for illness and injury. And this category has two subcategories, which are modifiable and non-modifiable, which we'll talk about later in some previous slides. But that's on page 66 at the bottom where it talks about the risk factors for injury and illness. And risk factors is something that increases a person's chance of illness or injury. So I do want to just backtrack and just talk about factors affecting health and illness overall. So many factors influence a person's health state, health beliefs, and health practices. These factors may be internal or external and may or may not be under the person's conscious control. Okay, so we talked a little bit ago about some things are genetic, some things can't be changed, right? And then there are some things that we can change, such as maybe drinking more water, eating more fruits and vegetables, exercising or taking a walk. This picture is located on page 56. This is figure 3-1, and it is the human dimensions composing the whole person. So I just mentioned each of these categories, and on the next slide, we'll talk about them more in depth. Okay, so human dimension affecting health. So there are 6 subcategories, as we just mentioned. We just seen the picture that was highlighting those 6 categories. They begin on page 64 and they extend into page 66. So physical dimension includes genetic, heredity, age, developmental level, race, gender. So race, genetic makeup can predetermine your risk factors for certain diseases, as well as maybe certain diseases you're not even at risk for because of your genetic makeup. Your age, as people age, they become more vulnerable to illness and disease. Developmental factors and levels all also play a important role in your health, right? If you have a disability, you may be at more of a risk of, developing an illness versus someone who does not have a disability, or even being able to understand the care and the diagnosis that's being conveyed to you. Emotional dimension. So the mind affects the body, and let's use anxiety as a example. So a mild level of anxiety is healthy. It keeps you focused. It makes sure that you're alert. However, moderate to severe levels of anxiety can impede a person's progress, right? You have people that freeze because of anxiety and they cannot even continue to speak or continue to move, right? So that is how your mind's affecting your body. Also, stress. So stress can kill you. Stress will raise your blood pressure. Some people have stated that stress will be linked to other illnesses such as cancer. So your emotional state can definitely impact your body. It may cause aches and pains. It may cause your stomach to cramp up. Just a few examples. Intellectual dimension. So your cognitive ability, your educational background, and your past experience falls under this one. So if you are talking to a physician that is your patient versus you're talking to someone who completed 10th grade in high school, you are explaining their disease process and treatment plan differently, right? Because they have different educational backgrounds and they have different um, past experiences. Okay, so cognitive ability plays a role in your health as well. Not economic, environmental dimension. So, housing, sanitation, climate, pollution of air, food, and water, all these affect your health. And as much as we want to believe that everyone has these basic needs met, you will be surprised that some people may have running water, but they don't have hot water, right? So they may not be able to bathe in the wintertime, or they may not have water at all. Some people may not have housing, or they may have a food insecurity. So, with that said, all of these things will affect your health. Of course, you have to have good nutrition in order to have good health. Social cultural dimension. So that is your economic level, lifestyle, family, and culture. So, of course, someone who is affluent and wealthy has better access to health care than someone who either one does not have health care at all or does not have or has maybe Medicaid, right? So therefore, you want to also take this in consideration and how this can impact your patient's health. And then we have our spiritual dimension, which is spiritual beliefs and values. And spiritual beliefs and values does not necessarily mean that someone has to subscribe to a particular religion or a particular practice. However, it is whatever brings that individual peace, right? So, what brings that individual peace could be walking, it could be playing golf, it could be running. So, the spiritual dimension is just taking care of the inner you, right? Okay, we have a true or false question. A person who keeps in touch with neighbors in an attempt to foster community feeling is promoting one's emotional human dimension. True or false? A few seconds. If you chose B, false, you are correct. A person who keeps in touch with their neighbor in an attempt to foster a community feeling is promoting one's social, cultural, human dimension, not the emotional dimension. The emotional dimension is a connection between the mind and the body, and it explains how the mind affects the body. I gave an example of stress and anxiety. So, risk factors in injury begins on page 66 and extends into page 67. So, modifiable, they are divided into two subcategories: modifiable and non modifiable. Not, modifiable things are things that a person can change to decrease the risk factor of illness or injury. Non modifiable are things that cannot be changed. This person is just at risk for this particular disease based on their maybe their demographic, their genetics. It could be um, just things that are on their sexual orientation, certain things that cannot be changed. 6 major areas of risk factors. They are age, genetic factors, physiological factors, health habits, lifestyle, environment. And in table 3-1 on page 67, it gives you an example for each of these 6 major risk factors. I would take my time to know them. Health promotion and illness prevention begins on page 67. And there's 3 different categories. We have primary, secondary, and tertiary. On this slide, we'll talk about primary and secondary. Health promotion is the behavior of a person who is motivated by their personal desire to increase their well-being or health potential. Illness prevention, illness or disease prevention, is also called health protection. Just in case you see that wording, it's the same thing as illness or disease prevention. And it's the behavior motivated by the desire to avoid or detect or maintain functioning within the constraints of illness or disability. So for primary, um, the primary level or category is directed towards promoting health and preventing the development of disease processes or injury. So on page 67, table 3-2, it has examples of nursing activities and is listed according to the level. So we have the primary level, secondary level, and the tertiary level, and that's table 2-3 on page 67. So nursing activities at the primary level may focus on people or groups. Also at the primary level, you may work with patients in both hospitals and community settings to provide care and use self-tests to help your patient assess their state of health and health risks, and to learn new health styles throughout the recommended lifestyle practices in support of health. So for primary, prevention teaching is a very important activity that nurses perform. Okay, and so some of the topics listed under primary for nursing activities include weight loss. So you may be educating them about weight loss, or telling them how weight loss may decrease their risk factors or improve their health. Diet, exercise, smoking cessation, reduction of alcohol consumption. So these are all things that routinely healthcare professionals speak with their patients about, changing these lifestyle habits. Um, Safety, use of illicit drugs, immunization. So that child car seat, putting that in properly, or having the child sit in the back seat and use their seat belt. All these things are educational pieces that the nurse will speak with the parents about. Immunizations, water treatment, safe sex practices, and effective parenting. So for secondary, the focus is on screening for early detection of disease and for prompt diagnosis and treatment if anything's found. So these are routine screenings looking for any particular disease so that we can detect it early and treat it early. So on our chart, we have examples of blood pressure screening, cholesterol check, glaucoma, HIV, skin cancer, pap smears, mammograms, testicular exams, family counseling. And also for secondary um, level, screenings are a major activity involving this particular level. Okay, so the tertiary level begins after an illness is diagnosed and treated. The goal is to reduce disability and help rehabilitate the patient to the maximum level of functioning. So, nursing activities on the tertiary level include teaching a patient with diabetes, how to recognize and prevent complications. So, again, they may have had an exacerbation of this chronic disease. Now we are educating them on the disease process and how to prevent any complications related to this disease or this diagnosis, right? And to restore them back to their optimum level of health, if not their baseline. So that includes using physical therapy to prevent contractures, right? With a patient who may have had a stroke or some kind of spinal cord or neurological injury. On page 67, some of the examples on table 3-2 lists medication, medical therapy, surgical treatment, rehabilitation, physical therapy, occupational therapy, and job training. Okay, I have a question. What is this example of a nursing activity that promotes secondary prevention as a level of preventive care? A. Conducting a smoking cessation class. B. Performing blood pressure screenings at a local mall. C. Range of motion exercises on a bedridden patient. D. Promoting safer sex practices in a school setting. Give you a few minutes. or seconds rather. If you answer B, performing a blood pressure screening at the local mall, you are correct. Secondary preventive care focuses on early detection of disease, such as heart disease in this example. Primary preventive care is directed towards the promotion of health and preventing diseases. Tertiary preventative care, tertiary care begins after illness is diagnosed to reduce the disability and rehab the patient. So the um, range of motion would have been a tertiary example, right? Because we're doing that range of motion, that's a rehabilitation and maintenance after the injury or disease process. Then the smoking cessation and safe sex practice would have been primary.